Hi, everyone. Welcome to today's webinar. We're so delighted you've taken the time to join us today. I'm Courtney Roman. I'm a Senior Program Officer at the Center for Healthcare Strategies, and I have the pleasure of moderating this webinar today, which is called Identifying and Reaching Family Caregivers Innovative State Strategies. So before we get started, a couple of brief housekeeping notes. To eliminate background noise, all phone lines are being muted today. If you have questions throughout the webinar, you're welcome to submit them via the Q&A function. There will be a moderated Q&A session following today's presentations, and we'll get to as many questions as possible. And finally, we're recording the webinar today. So that recording and the slides are going to be shared publicly on our website within a couple of days, and they'll also be emailed out to you. Next slide. So now I wanted to give you an overview of what we're planning to cover today. So first, I'm going to be introducing our really terrific set of speakers in just a moment. And then I'm going to be sharing an overview of some state outreach strategies and examples of where states have had success identifying and reaching more family caregivers, which is a common challenge for many across the country. And next, we're going to hear from our state speakers in Iowa, in New York, and in Texas, who all have really great stories to share on the strategies that they implemented to identify and reach more family caregivers. And then finally, we will wrap with some Q&A. Next slide. So now I am so pleased to introduce our really terrific speakers. We're so grateful you all could join us today. So first, from the foundations who have made this work possible, Ronnie Snyder is the Vice President of Program at the John A. Hartford Foundation, and Tim Nyosanga is a Program Officer at the Michigan Health Endowment Fund. Thank you so much to Ronnie and Tim for being here. We also have with us speakers from Iowa, New York, and Texas. So from Iowa, we have Christy Wilchin as the Regional Director of the Northeast Iowa Area Agency on Aging, and Megan Abramsky is the Family Caregiver Coordinator from the Iowa Department on Aging. From New York, Dina Prest is an Aging Services Program Analyst at the New York State Office for the Aging. And last but not least, from Texas, Holly Riley is the Aging Services Coordinator Director at Texas Health and Human Services. And Claire Irwin is the Age Well, Live Well Coordinator also at Texas Health and Human Services. So a huge thanks to you all for being with us today. Next slide. So for those who may not be familiar with CHCS, CHCS is a nonprofit based in New Jersey, and we work with stakeholders nationally to strengthen healthcare services to ensure better and more equitable outcomes, particularly for children and for adults served by Medicaid. We've been around since 1995. We worked with every state in the nation. CHCS partners with state and federal agencies, health plans, providers, community-based organizations, and community members to make healthcare work better for people who face serious barriers to well-being. And those barriers are poverty, complex health and social needs, and systemic racism. Next slide. So now I'm really happy to turn things over for a couple of minutes to our foundation partners, Ronnie from the John A. Hartford Foundation and Tim from the Michigan Health Endowment Fund. Ronnie, I'd love to turn it over to you.
Great. Thank you, Courtney. So hi, everybody. I am Ronnie Snyder, Vice President of Program at the John A. Hartford Foundation. And we are a proud funder of the Center for Healthcare Strategies and the Helping States Support Families Who Are Caring for an Aging America initiative. So I'm really happy to be here with you, along with my friend Tim of the Michigan Health Endowment Fund, which is a great partner of ours. And I'm also joined in the audience by one of our program officers, Scott Bain. And Scott and I want to thank each of the presenters for sharing your work and to everyone in the audience for your interest in supporting family caregivers. Just a few words about our foundation. The John A. Hartford Foundation is a national nonpartisan philanthropy. We're based in New York City, but like Courtney just said about CHCS, we operate nationally, and our mission is to improve the care of older adults. So we do that through work in three different areas: building age-friendly health systems, supporting family caregivers, our topic for today, and improving serious illness and end-of-life care. And so through our grants and programs, we're really looking to make care more equitable, more age-friendly, and aligned ultimately with what matters to us as we age. So for many of us, what matters most as we get older is the family and the friends in our lives, and especially those who we take care of and those who take care of us. So you probably know, if you're interested in this topic, there are about 53 million people in this country who are family caregivers. Most of them are caring for an older adult. And I would bet that most of you who are listening either are or know a family caregiver. I often say caregivers are the backbone of care in this country, and they need a lot more support from government and from, frankly, all sectors. To be effective, that support has got to be tailored to meet the diverse needs of diverse caregivers. And we all know that states have a really meaningful, frankly, a critical role to play in meeting those needs. So caregivers need to be identified and supported. They need access to respite care. They need to be integrated as members of care teams. And very frequently, they need more financial support. And the direct care workforce, which is the other side of that same coin in caring for older adults in these situations, needs to be strengthened also to support family caregivers and family members. So in addition to being the right thing to do, supporting family caregivers can help more people to do what they want, which is age at home, avoid unnecessary hospitalizations, and ultimately, in other ways, help states to manage their own healthcare costs. So these recommendations for caregiver support are included in the 2022 National Strategy to Support Family Caregivers, which was just released, I think it was 2 weeks ago. And that national strategy represents a whole of society approach to assisting family caregivers. So it's organized under 5 goals. There are about 350 federal actions that were announced across various different federal agencies to be enacted over the next 3 years to support caregivers. And there are more than another 150 actions for other sectors that are recommended, and those include state government. So you can support the strategy by helping to disseminate it. By the way, feel free to comment on it, because that comment period is open now and will be acted upon to ultimately improve the next iteration, which is going to happen in 2 years. So importantly, please publicly commit to the actions that you personally and your organization will take to support the implementation of this strategy, the first ever national strategy, because it does focus on the foremost needs of family caregivers. So today, I'm really excited to hear from states that are taking action. And we want to thank each of the states for the leadership and the support and the important lessons. And then I'll refer to you to another grantee of ours who's also collecting lessons, the National Academy for State Health Policy, because they've developed a really robust family caregiver state policy roadmap that builds on the work of CHCS and the various state leaders involved in the CHCS initiative, like those presenting today from Iowa and New York and Texas. So more resources for states will be forthcoming. And I'm going to stop there. Many, many thanks to Courtney. Thank you to the CHCS team and all of you who are here for raising up and supporting family caregivers. So I'm going to turn it back to Courtney and to Tim.
Thank you, Ronnie, so very much. Tim, wanted to welcome you too.
Well, thank you so much, everyone, for allowing us to be able to join this webinar. And Ronnie, I couldn't have said it better. I think you just cut out like about 10 minutes of what I was gonna say, and I'm just gonna say ditto. And so we were privileged to come alongside of this project to support Michigan's participation in the 8 states that were involved in the project. And a little bit about the Health Fund. We are a statewide funder in the state of Michigan, all the way from rural to urban areas. Our goal is to improve the health outcomes of Michiganders. And we fund in all areas, but our focus is on seniors and children. And so I was very lucky and felt honored to come alongside of the Michigan team to learn a lot about some of the issues they identified, and to what Ronnie has already mentioned. caregivers are truly the backbone of our long-term supports and services, and a lot of this huge system won't be able to function without family caregivers. And so in Michigan, the biggest thing I took away from this participating in this project was just the recognition that we have a lot of resources in the state of Michigan, and but it's going to be very important that all those resources are talking to one another, and that the family caregivers know how to access a lot of these resources, a lot of these great resources that we have. And so but anyway, I just wanted to say thank you, CHCS, for coming alongside of us and really working with us, and getting our teams very motivated, and really allowing us to have some of these rich conversations that I don't think have been able to kind of take place, wouldn't have taken place without your support. So thanks again, and look forward to learning from what other states have done. So appreciate it.
Thank you, Tim, so much. Okay, next slide, please. So I wanted to share with you all just a little bit of background on family caregiving, just to set the stage for the rest of the presentations today, as well as some framing of the Learning Collaborative and the incredible work of the 8 participating states, which CHCS has had such a privilege to lead over the last 2 years. Next slide. Just a few statistics to share. Ronnie actually said this already, that estimates suggest that 53 million people are family caregivers, and that means that they're providing care for an older adult or a child with special health care needs, and most of those millions are women. The average age is around 49. For most family caregivers, it's not the only thing they have on their plates. 61% are also in the workforce, and you'll hear Dina in New York talk about this unique population in just a little bit here. And this is also not a stage of life that goes by quickly necessarily. On average, family caregivers of adults provide care for 4.5 years, and that's increasing lately to more than 5 years. Next slide. So over the last couple of years, we have had very generous support from the John A. Hartford Foundation and the Michigan Health Endowment Fund. And we've led a family caregiving focused learning collaborative that included 8 states: Indiana, Michigan, Minnesota, New York, Tennessee, Texas, and Washington. The state teams came into the project really committed to working together to strengthen and expand strategies and policies for supporting family caregivers. And at the start of the project, they were asked to choose one of 3 areas of focus, and you'll see those here on the slide: strengthening family caregivers' capacity, establishing robust data collection strategies, and building formal cross-sector partnerships. So states were tasked with convening cross-sector teams, which all looked a little bit different depending on their goals, but typically consisted of state agencies, researchers, universities, area agencies on aging, community-based organizations, managed care organizations, health plans, and more. Teams reported back to us that this was sometimes the first time that many of them had worked together in this way, and really recognized how much work they could get done in partnership versus separately. And we are so happy to hear that some of the states are going to be continuing to meet in some capacity, even though this project has officially wrapped up. In terms of our role at CHCS, we primarily aim to foster an environment where states could learn from and exchange ideas with each other. And we supported goal setting and provided strategic guidance, and offered kind of some all-state learning opportunities on popular topics or kind of top of mind topics through webinars and then other virtual gatherings. Next slide. So over the course of this project, one of the key challenges that emerged for states is how to effectively identify and reach family caregivers. Now, these challenges happen for a whole host of reasons, but first and foremost, many people simply don't think of themselves as family caregivers. That word and that identity just don't resonate. In so many culturally diverse communities, caring for others is just what you do for your family and your friends. So for those groups, the idea of reaching out for help would just never cross their minds. But that means states can sometimes struggle with finding the best tactics and strategies for reaching these diverse communities that have deep connections to their roots and long-standing traditions. So this can lead states to seeing a significant gap between the family caregivers they know are living in the state and the number of services that are being used. So in terms of what can be done here, there are a few strategies to highlight, and these all bubbled up from our work with the 8 states in the Learning Collaborative. So first is to embed processes to identify family caregivers through state agencies and public-private partnerships, rather than waiting for family caregivers to self-identify. So instead of placing that onus on family caregivers to seek support, states can think about developing processes that allow for more organic opportunities for identification that really meets families where they are. So for example, in New York, the New York State Office for Aging, the New York State Department of Labor, and the New York State Department of Health launched a public-private partnership to survey businesses and their employees with the goal of identifying and reaching family caregivers. And Dina is going to tell you much more about that very successful partnership in just a minute. The second strategy is prioritizing stakeholder education to ensure approaches for identifying family caregivers are responsive to state and community context. So educating key stakeholders, so staff from AAAs, from managed care organizations and state agencies, really on the best approaches for talking to family caregivers is one way states can support ongoing self-identification. And you're going to hear from Christy and Megan in Iowa share about how their state has really done this. But one example is that the Department of Aging in Iowa encourages AAA staff to ask about family caregivers at every available opportunity. So when an individual is calling an Iowa AAA and asking for some help, staff are trained to say, are you calling about yourself or for someone else? And that can help prompt a conversation and potentially identify a family caregiver. The third strategy is tailoring outreach strategies and building trust to reach family caregivers. So successfully reaching family caregivers really requires identifying and then meaningfully partnering with the individuals and populations that have been marginalized by these inequitable state and federal policies. You're going to hear Claire and Holly talk about their family caregiving public awareness campaign in Texas that's set to launch. It really speaks to this, but they in Texas have also made a really meaningful effort to survey and to talk to family caregivers to help shape their master plan on aging. And finally, the last strategy, leveraging family caregiver assessments and surveys and tools to support identification and data collection and service delivery. So standardizing and formalizing approaches to better identify and understand family caregivers can really help states more effectively deliver services. So again, in Iowa, the team there developed a standardized family caregiver assessment, and that was implemented in the state's 6 AAAs in 2020. And since then, the state has recorded an uptick in the number of family caregivers using services, especially informal counseling, information and assistance, options counseling, and case management for family caregivers. So if you are interested in reading more about these strategies and a number of really great examples in addition to this from all of our states in the Learning Collaborative, we can put a link to the issue brief on this slide, and we can also put it in the chat. So now I am so delighted to turn things over to our state speakers. They're going to be sharing all the exciting ways they've been working to identify and reach more family caregivers. And first up, Christy and Megan in Iowa. So I'm going to pass things on to you.
Thank you, Courtney, and everyone at the Center for Healthcare Strategies to allow Christy and I to share our work in Iowa today. First, we would like to introduce our Iowa team. Julie Bergeson from the Iowa Department on Aging was our leader for Phase 1 and applied for Phase 2 of this initiative. During this 2-year initiative, Julie did take on a new role within our department. So this is when I came into the project. My name is Megan Abramski, and I'm the Family Caregiver Coordinator here at the Iowa Department on Aging. Also, a strong team member is Kay Vonix from Aging Resources, who brings a wealth of knowledge and is a caregiver herself. Christy Wilchin is with Northeast Iowa Area Agency on Aging and has worked with the Aging Network for over 22 years. Megan Zimmerman is Iowa's Dementia Friendly statewide coordinator, and she was a significant support, and her assistance with the development and creation of the resource guide was extremely valuable. We also credit several other leaders across Iowa, as through this initiative, we had many opportunities for collaboration with frontline staff and management teams that specifically work to get to know our caregivers every day. Iowa's goals through this initiative were accomplished through a streamlined process with our focus on prioritizing caregiver needs and building that outreach that is needed. Okay, slide 2. So to provide a little background of Iowa's Aging Network, I wanted to explain our structure and goals of the Iowa Department on Aging and the 6 area agencies on aging. This map shows the locations of each AAA and where they serve. We are established under the Older Americans Act, which allows us to serve older adults 60 or older, individuals ages 18 to 59 with disabilities, and their caregivers as well. Our core services include information and assistance, nutrition and health promotion, and services to promote independence. Our Iowa network strives to prioritize processes that provide person-centered approaches. We know that there is not a one-size-fits-all solution for identifying and reaching family caregivers, especially considering Iowa's rural landscape. However, with our statewide collaboration that developed a streamlined process, we're now better positioned to collect consistent data and then use that data to tailor our strategies and enhance our support to caregivers. During our involvement with helping states support families caring for an Aging America initiative, Iowa developed a common definition of how to identify a caregiver. We created a standardized caregiver assessment, which is a tool to gather and analyze our data, and then utilize that to drive our focus to carry out service deliveries to best support our family caregivers. And now with that, I will turn it over to Christy to go further into Iowa's project development.
Thank you, Megan. I am very happy to be with all of you today as well. So we'll move to slide 3. And I will start with Iowa's project development from day 1 to our present time. It's best to start from the beginning to get the clear picture of what brought us to today. Iowa was fortunate to be involved in phase 1 of helping states support families caring for an Aging America initiative. During the first phase, Iowa held a 3-day lean management process, which is a formal approach that supports the concepts of continuous improvement. It involves improving practices and value for consumers and heightening efficiency and quality. The event was comprised of representatives across the state from Iowa Department on Aging and the area agencies on aging that specifically work with family caregivers. The process included a third-party trained facilitator to keep conversations on track and at the forefront. At the end of phase 1 with the Center for Healthcare Strategies, we accomplished 3 main goals. We determined how to identify our family caregivers. Initial consensus was that most times, as mentioned before, family caregivers do not identify themselves as a caregiver. And furthermore, staff statewide had varying interpretations. And this was making our data somewhat skewed. Together, Iowa agreed on a basic screening tool to determine who an informal caregiver is, which ended in more reliable and consistent unit reporting across the state. Also, most importantly, by developing the identification of a caregiver, it allowed and opened the gate for more opportunities to offer and find the support caregivers need. Our second goal accomplished as we developed standard operating procedures, which consists of a flow chart to ensure caregivers are served based on their situation and needs. The service deliveries Iowa caregivers receive via their local area agencies on aging include information and assistance, case management, options counseling, support groups, informal counseling, and training and education. Third, we developed a caregiver assessment, including a strain index, to gather data on the needs and challenges of caregivers. We needed to develop this to gain information that we felt was missing while having conversations with our caregivers. We knew we needed to learn more from caregivers to best help them in their roles. The standardized assessment process gives our Iowa Aging Network a more holistic picture of the needs of Iowa caregivers. Iowa has found that collecting consistent, meaningful data across different regions of the state has highlighted service gaps and identified family caregivers that may be at higher risk, creating opportunities to improve program design. Phase 2 in helping states support families caring for an Aging America initiative allowed Iowa to continue building and carrying out our progress made in Phase 1. Our goals for Phase 2 included, first, since the new standardized family caregiver assessment was implemented in January 2020, we had a solid 2 years of data collected. Our goal was to review and analyze that data to determine any gaps and possibly areas caregivers are not being reached or served. Secondly, from that data, we wanted to determine who are our high-risk caregivers, what factors led to higher stress and caregiver burnout. Thirdly, we wanted to improve our approach or create additional innovative supports that would perhaps fill the gaps and reach more family caregivers to enhance our service deliveries. We feel confident we are moving towards this goal by developing community partners and enhancing our outreach and collaborative efforts. Slide 4, our findings. It is important to note our statistics gathered from our new Iowa Family Caregiver Assessment are completed only on informal family caregivers admitted to our options counseling or case management programs. The formal assessment is completed with caregivers that we meet with on a regular ongoing basis and provide advocacy with long-term goals in place. We also serve many caregivers short-term, such as through information and assistance and education, in which we may only have one or a few contacts with, and we do not complete the assessment on those individuals. Iowa completed 1,880 assessments in fiscal year 21 and 22. We strive to increase the number of caregivers we serve over the years and hope our more streamlined, consistent processes and standards assist with making the services our area agencies on aging offer more accessible and approachable for caregivers to reach out for assistance. Feedback from our caregiver specialists throughout the AAAs indicate the new assessment tool is conversational. It isn't cumbersome for the caregiver, and it allows them to develop rapport and trust with their caregiver specialist. We did note that over 50% of the caregivers are female, daughters or wives of the care recipient. Over 46% of the caregivers assessed are caring for someone with Alzheimer's disease or a related dementia. Our data collection was able to highlight those caregivers that scored a high level of stress from our assessment tool. It was clear someone caring for someone with dementia had higher strain scores compared to individuals caring for someone without a dementia diagnosis. Looking at all the caregivers that scored a high level of stress from our assessment tool, 79% of them indicated that they were caring for someone with dementia in fiscal year 21. Furthermore, in fiscal year 22, that percent increased to 87%. We determined our focus should be increasing our information, assistance, and outreach to caregivers caring for someone with dementia. The knowledge that we gained by looking at the data collection resulted in us knowing there was a need to develop a statewide resource guide. Next slide. In July of 2021, the state of Iowa began launching more dementia-friendly community initiatives and implementing Dementia Friends sessions across the state. Megan Zimmerman holds the role as the statewide coordinator of this movement. Dementia-friendly Iowa is driven by the increasing number of older adults living with dementia and the demands on their caregivers, along with the fear and stigma concerning dementia. Iowa's goal is to educate the community to support persons living with dementia and their care partners to be supported within the communities they live. We utilized Megan's knowledge and expertise to assist with building a new resource guide that is area agency on aging branded along with Dementia Friendly Iowa. Iowa's resource guide will build upon the uniform system to identify those caregivers who are at high risk for burnout and/or institutionalization, and those who are caregiving to individuals experiencing dementia or other cognitive impairments. Our next steps include distributing the guide to the area agency on aging family caregiver specialists, including our frontline staff answering the first call to inform, empower, and educate those seeking assistance, otherwise known statewide in Iowa as lifelong links. We will offer the guide as a resource to healthcare partners, share within the community, such as health fairs, aging and wellness expos, and all-encompassing enhance our statewide movement for a dementia-friendly Iowa. Next slide. While we would have loved to share the finished guide with all of you today, it is currently with our marketing team undergoing the final steps of the process prior to being released to the public. However, I would like to give a brief overview of the topics here that are covered in the Dementia Resource Guide. With this guide, we wanted to ensure our caregivers are being provided with the best resources. Often after a dementia diagnosis from a healthcare professional, we hear from the caregiver it is a time of uncertainty and fear and not knowing where to start to help to navigate this troublesome diagnosis. We did not want to make the guide too lengthy, as it can be difficult or overwhelming for caregivers to receive too much information all at once. We are covering the basics to guide them in the right direction and provide links for them to explore more. Our guide, as completed, is 6 pages. Each area agency on aging will have it available on their websites. Frontline staff will be able to email or mail the guide to caregivers, and our community partners, such as local hospitals that we partner with to provide return to community, will share the guide with their patients or prior to referral to their local area agency on aging. We are also looking into adding a QR code to other agency brochures and media pieces to direct them to this guide. And lastly, to wrap up and stay within our time, we want to give a few thank yous. So again, we would like to provide acknowledgement to our Iowa team, as well as extend the appreciation to all professionals across our state that collaborate so well. We gather at least monthly to work together for the betterment of our caregiver programs, and we're instrumental in assisting with the completion of the resource guide so that all agencies have ownership and buy-in to the resource tool. We also appreciated hearing from all the participating states in phase 2 of this initiative. Conversations had during virtual hangouts sparked our interest and gave us innovative ideas to explore. And lastly, the Iowa team would like to extend a thank you to all the support from the Center for Healthcare Strategies, Courtney, Anita, and all involved with this initiative made possible by the John A. Hartford Foundation and the Michigan Health Endowment Fund. Iowa will always strive to improve and move forward. Our work will never be done, especially as our aging population grows, sharing an increased need for active supports and services for caregivers who are the backbone of our aging citizens.
Thank you, Christy and Megan. Such great work from your team, so inspiring. Thank you for sharing that. So next we have Dina from New York. I'm going to pass things on to you.
Thank you so much, Courtney. So hello, everyone. My name is Dina Prest, and I work as the Caregiver Support Program Director at the New York State Office for the Aging, which we often use our acronym NYSOFA. And I'm delighted to be here with you today and have this opportunity to share information about NYSOFA's Working Caregiver Initiative, which is aimed at identifying working caregivers that are in need of help and connecting them to existing services and supports. The overall purpose of the initiative is to make caregiving a statewide, all systems issue in both the public and the private sector, and that's driven by data. We are making this an all systems issue by educating the general workforce, the leadership, and the caregivers themselves And we want them to understand the impacts that caregiving responsibilities have on businesses and how the business can help them by offering flexibilities and getting them connected to available resources early. We also want to better understand the impact of caregiving on employees from their perspective, you know, who they're caring for, how much time they're spending caregiving, what type of tasks, etc. So now I'd just like to kind of share some more specific information on the efforts that we have underway. So if we can go to the next slide, please. So this year, NYSOFA launched an anonymous, no-cost, web-based employed caregiver survey to help employers and the employees understand the scope and needs of employed caregivers as they strive to create healthy and supportive workplaces. The state's working caregiver study is already helping to tell the story of caregiver impacts in New York State. Many employees provide daily support to an older adult, a child, or person with a disability. This includes transportation to doctor's appointments, arranging and preparing meals, providing financial support, grocery shopping, housekeeping, assisting with medical tasks, money management, assisting with the completion of forms and documents, assisting with medications, and many, many more. So the survey results are telling us how these individuals that the employed caregiver is caring for and the relationship between the caregiver and the care recipient and the reasons that they're providing care to this individual. And again, the time that they're spending, the employment impacts, and then what specific resources that they themselves are seeking. So we're continuing to collect data through the survey so that we can better understand and address the needs of working caregivers. Next slide, please. We also developed the New York State Caregiver Guide for Businesses in partnership with the Department of Labor and the Department of Health and the Workers' Compensation Board. In 2018, there was legislation that enacted NYSOFA and the New York State Department of Labor with developing this caregiver guide to help support working caregivers across the state. We've modeled our guide after the Minnesota Board on Aging's Caregiver Guide with their permission, and the Caregiver Guide for Businesses has been designed to support New York's business community and employed caregivers by providing relevant information on how to best support the working caregiver. The guide includes links to programs, supportive services, workplace data, and information about New York State's paid family leave, which is a benefit that provides workers with job-protected paid time off to care for a family member. We've also created a fact sheet highlighting many statistics in hopes to generate interest for businesses reading the full guide. And hot off the press, we actually just finalized a accompanied brochure that's intended for the business to have a resource that they can share with the employee once they identify that they are in a caregiving role. You can learn more about this caregiver guide and the survey that we have underway by visiting our website. So we'll put a link to that in the chat. I believe Courtney or someone from CHCF was going to help with getting that information to you. Next slide, please. So through the CHCF Learning Collaborative, which we were very excited to be selected, we actually decided our project team, we had partners from the New York State Department of Health, the Alzheimer's Association, our statewide Caregiving and Respite Coalition, the Department of Labor. We decided that we wanted to focus on developing a written dissemination plan for this newly developed New York State Caregiver Guide for Businesses so that we could be very strategic in identifying ways to share this important resource widely. We're very glad that we took the time to strategically plan and have a written dissemination plan to help guide our work. A few of the dissemination methods that were identified is sending the guide to employers that were noted in the survey responses, including descriptions of the survey and the Caregiver Guide for Businesses in agency newsletters. We've built out a specific page on the NYSOFA website for employers and family caregivers. The Department of Labor assisted us in sending the guide via email to over 800 businesses, and they intend to repeat this effort each year for us after we've reviewed and updated the guide. The New York State Caregiving and Respite Coalition, which is one of our partners, is promoting the guide at HR conferences. And we are currently developing a contact list for state chambers of commerce to request their partnership on distributing the Caregiver Guide for businesses. And we're going to ensure that the chambers are diverse. For example, the New York State Coalition of Hispanic Chamber of Commerce or the New York State Minority Business Coalition. And then our director, Greg Olson, he plans to host a Facebook Live event featuring a business owner who's actually used the guide so that they can speak to its benefits. As I mentioned, we do plan to review the guide and update it annually. We're actually required to do that because we want to make sure that the information and the resources that are available in the guide are up to date. So when we do that each year, we're intending to also update this dissemination plan as well. Next slide, please. So for our next steps in New York, we have a few things going on. Some have launched, some haven't. We've teamed up with Archangels and we have launched the Any Care Counts campaign, which is a way to recognize and support the over 4 million unpaid caregivers across New York and connect them to available resources. As I previously mentioned, we're going to be doing Facebook Live events to raise awareness. We'll continue to speak with workforce development boards and businesses statewide to encourage them to understand the employees' struggles with balancing work and caregiving responsibilities and offer them the Caregiver Guide for businesses to provide them those tools and resources to implement a healthy workplace environment. And as I mentioned earlier, right now we are keeping the employed caregiver survey open so that we can continue to collect data, and we'll be using this data and the data from the Caregiver Intensity Index to help gauge the needs of caregivers and inform our efforts in assisting them. We've also teamed up with our Public Communications Bureau to develop some short training videos on working and caregiving to help self-identify and make available resources for the employers and their employees. And it's not listed here on the slide, but I thought it was worth mentioning. NYSOPA also has partnered with the Association on Aging in New York to offer TruUlta, which is a web-based caregiver education and support platform. And we'll be offering this to any unpaid caregiver in New York State at no cost. This is an evidence-based caregiver training, and it helps families build skills to manage care at home for loved ones of any age, and it connects them to local resources and support services by delivering personalized education, training, and information links. Now, this isn't specifically focused on working caregivers. However, you can see how a self-paced online training curriculum, that's available any time of day would be attractive to a working caregiver that's, juggling responsibilities at home and trying to make it to the office. So this initiative is being supported in the 2023 state budget through NYSOPA's programs to address social isolation and expand our caregiver supports. And I just want to extend a thank you to Iowa. I feel like we learned so much through this collaborative from the other states, from the support we got, from the team at CHCS. So thank you. Thank you for the opportunity to, partner for the last few years and for sharing our information today.
Thank you, Dina. So incredible, such incredible work that you all were able to do in New York, and are really grateful that you were able to share it with us today. So next, last but certainly not least, Holly Riley and Claire Irwin in Texas. We're going to pass things over to you all.
Thank you, Courtney. We're really excited to be here. My name is Claire Irwin. I work with the Aging Services Coordination Office at Texas Health and Human Services, and I'll let Holly introduce herself quickly.
Hi, everyone. I'm Holly Riley. I'm the Director of Aging Services Coordination for Texas Health and Human Services.
And we're excited to be here to talk a little bit about our project. Next slide. Before we go into our project, we really wanted to take a minute to share a little bit about older adults in our large state. Texas has the third highest population of adults age 50 and over. In 2020, we had 9 million adults age 50 and older, and that population is expected to grow by 82% to 16.4 million by 2050. And those are a little bit different than the statistics there on the slide. We have 60 and older statistics there on the slide, so you get both. We have 1.29 million adults 65 and older who have a disability, and an estimated 3.4 million Texans help a loved one with their activities of daily living. And not only is Texas a large state, but it is also home to a large population of older adults who are contributing to their communities, providing care for loved ones, and receiving care. And because of the size of Texas, it can be challenging to reach all the caregivers in all the different communities, both urban and rural across the state, which is why we were really excited to be involved with this CHCSTA grant. Next slide. So I'll just talk briefly about our team and the group that we put together for this opportunity. Our team included representatives from Texas Health and Human Services, our office, and then a number of different offices throughout our large agency. We're a really big, I think the biggest state agency in Texas. And so we were able to involve a number of different offices in this effort. We also had representatives from AARP Texas, from the Texas Workforce Commission. We had representatives from our area agencies on aging, the Texas Association of Regional Councils, and the Texas Governor's Committee on People with Disabilities. And we met as a group to establish our two main goals for the effort. The first goal was to create a family caregiver awareness campaign, and the second to develop a toolkit for state leadership with strategies for enhancing family caregiver supports. And when we met with our team, we talked about the idea of the campaign, and the group was immediately supportive. We were able to look at research and some roadmaps that are out there that really helped us to inform and guide our discussion around the creation of the campaign. Next slide. So for the CHCS TA opportunity, we created the two work groups that helped us. The campaign work group really helped us to think through all of the different aspects that go into a successful campaign. They provided important insights into the barriers that might be faced. They talked about how to raise general awareness of caregivers and caregiving in order to help address the issue of people not identifying with the word caregiver. Because our group was really made up of professionals in the aging and related fields from a wide array of backgrounds, we were able to discuss the differences in caregiving across many cultures. And we also wanted to make sure we did not overpromise to have all of the answers, because some communities have limited supports and limited resources. So we wanted to be very realistic about what we could offer as far as support. We wanted to create a hierarchy or a list, kind of a ranked list of caregiver needs to help us focus on which resources we should highlight in the campaign. One thing that was especially helpful, that we as a group created a comprehensive list for marketing of the campaign and divided it into funded and non-funded options. So we would start with an idea that could be accomplished with little funding or no funding, and then outline enhancements for if we had funding. And Holly's going to talk about the funding aspect in just a minute, but the group really did help us to apply for the funds that we did end up receiving, because it was a really quick turnaround and we wouldn't have been able to seize the opportunity without the group. But one of the really helpful things that the group did was help us identify the goals of the campaign. They really helped us to decide what we wanted to focus on. We wanted to clarify for Texans and for policymakers the definition of caregiving, different types of caregiving, the roles of the family caregiver. With the campaign, we were working to emphasize that many people are caregivers. There is a value in caregiving, and caregivers can have pride in that role. It's okay to ask for help, that caregiving can be challenging, but they don't have to be alone on the journey. And we really wanted to highlight support that's available, and then also highlight the need for self-care, and that many caregivers are eligible to receive services and they might not be receiving those. So I'm going to pass it over to Holly to talk more about the funding component. So next slide.
Thank you, Claire, and a huge thank you to CHCS for this opportunity to participate in this group. It's really been fantastic. Claire has highlighted some of the benefits that we received from this multi-state collaborative, and even though the grant is over, we are continuing to learn and receive benefits from this work. As she mentioned, really thanks in large part to the work of our state team that was working on the campaign when the American Rescue Plan funding for Medicaid home and community-based services, the FMAP increase was made available in early 2021. We had everything ready and justification and all of the wheres, whys, and for-tos ready to apply for that money. And we worked with our HHSC Medicaid office to apply, and we were really pleased to learn that we received the money for the campaign. Some of the funding requirements that we have for this is that we have 1 year to spend this money. And so we needed to get a marketing vendor secured quickly. As I know you can all imagine, a statewide caregiver campaign for Texas is going to be huge. And so again, really thanks in large part to the work group efforts. We already had the campaign messaging and elements identified that Claire talked about, and the big heft of developing a request for proposal and the statement of work. A lot of that was already done. The big work was really already done. So it made it much easier for us to secure a vendor and really, work within that compacted time frame that we have for this campaign. On this slide, we have some of the campaign criteria that we have with this. We know this is a rare funding opportunity. It's kind of like our unicorn. So we wanted an evergreen product that's going to resonate and stand the test of time. We want something that'll be with us for a good while. We want to meet the needs of many different types of caregivers with this campaign. And we also want something that community providers would want to use. And so that's why we have the end products. A lot of them are going to be editable so that these local communities and providers can use this marketing material as well. Another outcome that we have with our campaign is to have a media kit developed that so not only can they use the materials and edit them, but how to use the materials for their own marketing. Next slide, please. Thank you. So for next steps, we are really excited about this campaign and what it's going to provide, and we want to make sure that we're capitalizing on this huge opportunity. An element of our current and ongoing work is mapping where the caregiver supports and resources are in Texas. This helps us see where there might be some needs, and it's also helping us identify partners and stakeholders in this process. So future forward work is going to be to continue developing and fostering these partnerships and identify where we collectively have opportunities to collaborate and create resources to fill the gaps and needs. Our campaign launch is set for August 2023. This is a marketing plug right now, so mark your calendars and keep your eye out for that. The launch, we know, is going to highlight who and what caregiving is, as well as what available supports are there for them and the people that they care for. And as a result of that, people are going to have questions about caregiving and the available resources. So we also have in our future plans to regularly survey caregivers and stakeholders on what their needs, issues, and concerns are. And that data is going to help us tailor the campaign if we need to, and will help us be proactive in developing supports to meet the needs. And Courtney mentioned we have a master plan for aging. That data is also going to go in there and inform our master plan for aging, the Aging Texas Well Plan, and help us strategically plan at the state level on caregiving supports. Claire had mentioned at the beginning that as part of our collaborative work, we had a second goal, which is to find out what other states were doing to provide support for caregivers. And that work is also going to continue past this grant, and it's going to result in a toolkit that's going to highlight programmatic and policy level best practices to support family caregivers. And we'll be marketing that out to those service providers and state level leaders. Next slide. And we always like to connect and brainstorm with other organizations and other states. So we encourage you to reach out to us. There's our contact information, and echoing the other states, our huge appreciation to CHCS and the multi-state collaborative. We really have learned so much from everyone, and this will just continue to inform our efforts. So thank you so much.
Fantastic. Thank you, Claire and Holly. Can't wait for August 2023. We'll be counting down the days. Thanks for sharing all of that with us. You all have been so thoughtful about the campaign and all the work leading up to it. So congrats to you all, and thanks for sharing. So we are going to move to some Q&A. And we've gotten some in the Q&A box here that we've been monitoring. So if you have questions, please do feel free to pop them in the icon at the bottom that says Q&A. And we have a couple in here that are specific to some of our states. So to Christy and Megan in Iowa, we had a question about if the caregiver flowcharts that you all used and your assessment, if that's available publicly, or if you're able to share that. I'm not surprised we got this question. Everybody wants to know how Iowa did this.
Yeah, I can answer that. So our family caregiver assessment is available, and it is on our website, which is iowaaging.gov. Or you can just look up Iowa Department on Aging and you can see that assessment there.
Thank you, Megan.
Yep.
And there was also a question about the assessment. Is it conducted and stored in an electronic method that can kind of aggregate assessment results? And I think the answer is yes, but I don't know all the details.
Yeah, I can take that one, Megan. We do use a database called WellSky. And that is used across the state. So all of the area agencies on aging use that database to put all the information and run various reports from. So just kind of important to note, it's very consistent, and because we're using just the one database to put all the information in and can aggregate that information.
Mm-hmm. Excellent. One question for New York. So Dina, there was a question about what staff are supporting caregivers using TruAlta. Are there caregiver staff, intake staff? How does that work?
Great question, and I'm sorry I didn't share that, but the way that we've structured it, and I'm gonna, Courtney, if it's okay, I'll put a link in the chat that you can share as well, just if people want to read more about, you know, how we kind of structured this. But because it's free and open to any unpaid caregiver, and we're not, you know, limiting it to just the population of caregivers that like our agency serves, which kind of is wonderful, because our partners and, you know, anyone who's working with caregivers can share this information and, you know, help the caregiver get connected to the resource. So we do depend on our coordinators, our caregiver support program coordinators at the AAAs, but we also ask them, you know, to kind of share with their local community-based organization partners as well. So it's just really, you know, social media. We did a big press release. You know, we just are trying to get the word out widely. And you know, as far as activity, I believe since we've launched it that we're seeing a lot of caregivers accessing it. But again, I did provide the link so you could kind of read a little bit more about it. And I think I saw something too about cost, and I really don't know anything about that because I'm sure our agency director negotiated that for making it available, I think, statewide to anyone.
Great, thank you, Dina. There was a question for Texas. So Holly and Claire, you all mentioned, you know, and this has been the theme throughout all of this, is really kind of confusion or just not identifying with the term caregiver. And in some of the messaging work that you all had done, there's a question if there are synonyms that have worked, or was it kind of context around the word caregiver that's maybe been more successful? Any thoughts that any work you all have done there?
We have learned from Wisconsin and others and the work done by the Wilder Foundation before we even had the funding for this, that most people don't identify as a caregiver, but they do identify in the act of giving care. And so we're working on that model of really addressing the act of the effort and not so much the term. We will be using caregiving, but the effort to drive them to the site with the resources and that information will be more around the act, support, strength, these sorts of efforts that the caregiver puts out. So there is that focus that we're taking with it based on what the Wilder Foundation identified with their work.
Great. Another question kind of for all of you. There's a question asking about, do you all see that this is a problem in New Jersey? I'm assuming in other places too, seeing residents facing a benefits cliff or wall and resources. Are resources limited to people below certain income levels? Any of you faced some of those kind of cliffs and have worked around that or thought through ways to better support that?
I'll jump in real quick, Courtney. We hope that the toolkit that we talked about with the best practices for the policy and programmatic recommendations will address some of those cliffs that might be out there.
Great. And a question for Iowa. If you all were giving some advice to someone who wanted to start the process with an assessment, what would you say? You all did such incredible work with your lean event, which I've still never gotten over. I love that so much. And just some other ways that you all really came together to move that forward. So what advice would you all give for a state that maybe wants to tackle that?
Sure. As you mentioned, Courtney, I was fortunate enough to be a part of that lean event that we held a couple of years ago. And so it was very, very helpful. It allowed a very 3-day focus. So it was very focused, no other outside distractions. It brought representatives from all over the state that really have involvement with family caregivers. And there's also a third-party trained facilitator to really just keep it moving. And I will admit there were a lot of different opinions. The different AAAs were doing things very differently, interpreting things very differently. So that facilitator was very helpful, but it always brought us back to, why are we here? Even though we had varying opinions, we were all there for the same reason. So that just kept drawing us back to, our goals and our mission. And so that lean event was fantastic. And I really do believe that through that event, the value streaming, that we did with our process and developing our standards, really developed the consistency. And then we had an implementation plan afterwards, where then we continued to meet and collaborate to finish and follow through with our work. So yeah, I really do think that our lean event helped drive our goals and got things accomplished.
That's great. We have a question here kind of for all of you, asking specifically about the National Veterans Caregiver Support Program, and if any of you have included any state veteran support offices in some of your work. I'm sure that has happened. So if any of you can speak to that a little bit, that would be great.
I'm happy to go first, and I know that Iowa and New York can jump in too. And I just also want to mention that Christy was talking about the group that she facilitated there. And this is an example of how this work is continuing to inform and support us. In the wrap-up meeting that we had, she shared that, and Claire and I were writing each other notes saying, this is something we should do for next future forward. So it really has been a great benefit to all of us to participate in this. we are very lucky in Texas. We have our Aging Service Coordination Office that Claire and I are a part of. We also have a Disability Service Coordination and Veteran Service Coordination Office. And so they are part of our campaign work and our outreach and our identifying of the populations and the resources for them. So where we go, we all go together collectively. And again, this is a rare opportunity for us. We're really treating it as such, and we want to cast as wide a net as possible with our campaign. So identifying all the types of caregivers and the populations that are there to support them is critical for us.
Great. Christy or Megan, any other thoughts or Dina on veterans?
Courtney, it's Dina. I would just say we actually did, if you recall, with our learning collaborative, we had a representative from veterans. Yes. And I apologize for not mentioning it, but I think he was really floating in and out. He's very, very busy, but he did actually help us a lot, you know, with our work. But I just wanted to share that I know at the local level, like we have through our No Wrong Door, our New York Connects program, the program standards require that they actually have a long-term care council. And so they do have representatives from, you know, veterans that participate in monthly or, you know, bi-monthly meetings where they're coming together and actually sharing information about resources and working collaboratively.
Great. Thank you so much. And Dina, this one is for New York also. I'm so sorry if you addressed this already. This came in and I'm just reading it now. The digital platform that you all are using with caregivers in the workplace, are there a couple more details on that? That's been, that's come in here just recently, a couple of questions on that.
Yeah, the article to the link that I shared
it's in there. Okay.
Address all of it, but and I just wanted to clarify the training is not specific for working caregivers, but I was just making the connection that because it is self-paced and available any time of day, right? Like for a working caregiver who, you know, time is limited, right? And so fitting something like that where there's education that could help them with building skills, it's a nice feature that it's available 24/7, right? So that they can kind of access it when they would like to. So I was just making the connection myself of it being helpful for a working caregiver, but it's not specific for them.
Yep, makes sense, makes sense. And Dina, related to that too, you know, is there messaging that you all think has really worked to help employers understand the importance of supporting working family caregivers? Obviously, it's so beneficial, but is there kind of a hook? What have you all said that made it resonate, do you think?
I honestly feel like the startling statistics, right? Like they just jump out at you. And I feel like us putting together that fact sheet where it kind of, you know, catches their attention immediately, that then may result, which we've seen, in them wanting to have a copy of the full guide and be able to go through that. Also, I feel like the caregiver stories themselves are just so impactful. We recently had a statewide conference that we focused on engaging businesses, you know, managers, HR professionals, to, you know, learn how they could better support their employees who are caregivers. And we had a panel of working caregivers that told their story and, you know, explained, you know, what might have pushed them out of, you know, their profession because they weren't supported. So I feel like that was incredibly impactful for, you know, for those managers and business owners to hear. And I will say too, our statewide coalition did an actual video that was a message to businesses, you know, letting them know that they were available as a resource and to provide training to support them. But so the messaging there, I think, was good too, and just, you know, getting their attention.
Great. And just the last question here is for Texas. So for Claire and Holly, the toolkit that you all are planning to develop, will that be something that's available publicly at some point?
It should be, yes. You know, it will be again at that policy level, so it might not be applicable. It's not probably going to be something that's going to be on the homepage, but we'll have it available on the website. There's going to be tools for the provider network and state leadership. Yeah.
Great, great. Thank you. Thank you. Well, we have just a couple of minutes left, but I didn't want us to end the line without just on behalf of the CHS team, our just profound thanks to all of our state speakers. Thank you for being here. It has been an honor, truly, to work with you all. I don't know if anyone was keeping count, but this entire project happened, every single minute of it, during the pandemic. And just to see the work that has come out of this gives me chills. And I have loved every moment of it. We are so grateful that you all put in such hard work in a completely unprecedented time. The grit these folks have is amazing, ladies and gentlemen. So thank you. Thank you to all of you. And just a couple of reminders, the recording for this and the slides will go up on chcs.org. You'll also get them emailed to you. And when you sign off, there will be a little survey that pops up if you're willing to take that, so we can make sure that we our webinars are still pretty good going forward. We'd love to have your feedback. So thank you truly to all of our speakers, to Ronnie and to Tim for their incredible support for this work, and for everybody who joined us today. Thank you very much.